Namaskar, welcome to Ayushakti's YouTube channel. I am Dr. Smita Naram, founder of Ayushakti, and today with us we have Dr. Tom Mitchell from USA. He is practicing Ayurveda for last 20 years and he is practicing Ayushakti way of Ayurveda for 20 years in North Carolina, Raleigh. He is very successful and we would be talking today about ulcerative colitis. Would you like to share some experience?
Yes, thank you. Pleasure to be here. I wanted to share a couple of experiences about ulcerative colitis. It's a fairly common problem, actually, and there is really no effective cure with allopathic medicine. Allopathic medicine will give immunosuppressant drugs or drugs that suppress the immune system because the immune system is attacking the lining of the digestive tract and causing the ulcerative colitis. So, but they have to be taken long term. There are many side effects. So it's not an ideal solution. But Ayurveda has some very effective solutions for this. And one particular case was one of my patients came in a while back, and she had been to the gastroenterologist and was diagnosed with ulcerative colitis. She was having frequent loose stools and diarrhea. She was having to go to the bathroom about 20 times a day. And when they did a colonoscopy in order to diagnose her, and when they did the colonoscopy, they found that the lining of her colon was is called friable. So as soon as they touched it with the probe and the colon, it started bleeding. So it's a pretty severe type of ulcerative colitis. And so she was warned that she had to take the allopathic medicines in order to prevent actually having to have her colon removed over time. So she came to see me. She had been taking the immune suppressant drugs and she didn't feel good. And she still had lots of diarrhea and difficulty with digestion. And so we started treating her. I gave her recommendations in terms of diet and some Ayurvedic medicines to take. And over the course of 9 months, she got better and better. And after 4 months, she was able to stop taking, she personally decided, it was her decision to stop taking the allopathic medicine. She gradually got off of it under the supervision of her doctor, and she got better and better, and at the end of 9 months, she had another colonoscopy, and they could find no trace of ulcerative colitis.
Wow.
After 9 months. It was really amazing, yeah.
Brilliant.
Yeah. So I was very happy about that, yeah.
Now, I do remember I met this Jean Frederic
Yes.
In your office
Yes.
when I was traveling to US in your
Yes.
place, and this person had already a colon removed.
Yes.
You remember
Yes.
he already had severe ulcerative colitis and he had colon removed, and the doctors created pouch, and there was a swelling even in that pouch. And he had a severe diarrhea and pain, constant pain. And he got better already.
Yes, he couldn't digest anything,
He
yeah.
couldn't digest anything, and
Yeah.
everything he ate was just passing through the stool. And he had normal stool already in 6 months, and he could digest everything, and he's now living normal life.
Yes.
But of
Yeah.
course, I mean, they still have to follow the diet, and I recommend everybody who has ulcerative colitis to follow certain diet. Would you like to share the diet?
Yes,
Yeah.
sure. So the important thing with ulcerative colitis is to avoid inflammatory foods, and probably the two biggest causes of inflammation in terms of food are wheat products and dairy products. Also, it's important to avoid very sour, acidic foods, so things like tomatoes and citrus fruit, and also fermented foods, so vinegar, soy sauce, alcohol, obviously, of course, and hot, spicy foods, so chilies in particular, are really the main, and heavy, difficult to digest food like fried foods.
Yeah. And actually, for the people, just for their for them to be able to follow the diet easily, most of the pasta, bread, pizzas, and Indian chapatis are all gluten. So in America, you do find nowadays gluten-free bread and gluten-free pasta, but you can use millet. You can use in Indian people can use jwari, ragi, something like this, or rice, chapatis. Western people can have different options, lentil pastas, I think, and
Yes, chickpea.
corn pastas,
Chickpea
chickpea
pasta.
pastas, the different kinds of pastas which are completely gluten-free. So you have to, the diet is fundamental in ulcerative colitis because one mistake in the diet can actually prolong your healing process.
Yes.
And so it is important that if you want to get rid of it completely, then follow it very strictly. You can also do this home remedy as a support to the diet, which would be pomegranate juice fresh, half a glass 2 or 3 times a day. You can add a teaspoonful of turmeric in this pomegranate juice because turmeric helps with the immune system. Also, for people who have lots of loose stool, generally all the dairy should be completely stopped, except Ayurveda says that freshly prepared yogurt, 2 tablespoons, can be given like a medicine to stop the diarrhea quickly and immediately.
So yogurt that's made at home.
At home, yeah, not the
Store-bought.
the store bottle, but homemade yogurt, fresh, which is not sour at all. It doesn't taste sour at all. And take that 2 tablespoons and add a teaspoonful of cumin powder, half a teaspoon ginger powder, and coriander powder, a teaspoonful, maybe a little bit of salt. And this, if you take it 2 or 3 times a day, it can stop loose stools very quickly and immediately. Once you have loose stools under control, then you may not need to take it. Of course, there are some people, even they react with yogurt, they should not then take it. You did give some herbs from
Yes.
Ayurshakti, I believe.
Yes.
Yeah.
Yes. There is a very effective Ayurshakti medicine. It's called Daru Mukti. I had her take a high dose of that. to
Like
help-
almost 2 tablets, 6 or 8 times a day or something?
Yes. And also, I gave her, it's called Gulcacid. It helps to reduce the acidity in the stomach. And then also Raktabandha, which is an Ayurshakti medicine that helps to control bleeding. It's very effective also.
Wonderful. Thanks for sharing that
Thank you.
experience.
Yeah.